Afternoon, guys. Today I'm going to tell you about the disease cystic fibrosis, how it emerges, its symptoms, treatments, and generally everything you need to know. Cystic fibrosis is a recessive genetic disease which affects secretory glands, pancreas, lungs, and the intestine. It is characterized by the abnormal transport of sodium and chloride ions across the epithelium, leading to viscous secretions of thick mucus. The disease is caused when a person inherits 2 copies of mutated CF gene, which produces the protein cystic fibrosis transmembrane regulator, CFTR. This CFTR controls the amount of fluid lining the airways and other organs such as the pancreas. It also affects the regulation of the transport of salt and water across body cells. As a result, salt and water inside the cells become insufficient, and the mucus and the fluid which is produced by the lungs becomes thick and viscous, blocking the airways and other vital organs. Inheriting the disease, for a person to get this cystic fibrosis disease, he has to get two of the CFTR genes, one from the mother, one from the father. This is the red one representing the person with the CFTR genes, and there are 1 in 4 chance of a person in getting both the CFTR genes. Secondly, if a person gets 1 CFTR gene and 1 normal gene, there are 2 in 4 chances of the person to be a carrier of the disease, and there is 1 in 4 of the chances of a person to be neither cystic fibrosis carrier or to be affected. So in total, for a person to get this cystic fibrosis disease, he has to inherit 2 copies of the CFTR gene, that one. And for a person to be neither a carrier nor an affected person, there are 1 in 4 chances for a person to get that CFTR gene, and there are 2 in 4 chances for a person to be a carrier of the disease. There are a vast symptoms depending on whether the person is severely infected or partially infected. This comes into play with the person's age, and on the other side, their immune system. There are a vast number of symptoms. For example, there is coughing and wheezing as the person tries to shift the mucus. There are recurring chest and lung infections, which are caused by the buildup of the thick mucus in the airways. When a person has got cystic fibrosis, they produce large smelly stools. There is malnutrition, and as the body cannot produce digestive enzymes in the pancreas. The pancreas may become too damaged, leading to diabetes. Cystic fibrosis patients are prone to sinuses and hay fever. Adults may develop polyps in the nose or sinuses. There is development of arthritis, that's pain in the joints and swelling. Patients may be prone to osteoporosis, and this condition is the thinning of bones. In men, there might be infertility, which is caused by the sperm ducts not working properly. In women, the menstrual cycle may become irregular, and the ovum ducts may become thick, and the cervical muscle may become thick also. In the liver, the ducts become brittle and can cause blockage, and the mucus cannot be moved to all parts of the body. Diagnosis of cystic fibrosis. This is normally done by confirmation of 3 different tests. These tests include the sweat test, nasal potential difference test, and the genetic testing. Let me tell you in order. We got the sweat test in the main category. This is the basis which is mostly used to confirm the disease. With this test, how it is carried out, let me explain to you. A person is given a medicine, and the medicine is injected on the forearm. As the medicine is injected in the forearm, it forces the person to secrete sweat, and the amount of sodium chloride ions are taken from the person's forearm, and they are tested for the presence of cystic fibrosis. If there is too much concentration of sodium and chloride ions in the person's sweat, then that's the positive diagnosis of cystic fibrosis. In children, 60 moles is too much amount of sodium chloride ions in the person's sweat, so that's a positive test for cystic fibrosis. And now we go to this nasal potential difference testing. With this nasal potential difference testing, the person is given a medicine called papillomine. This papillomine medicine, it helps the person to secrete mucus through the mucous membranes in the nose. So a sample of the person's mucus is taken and it is tested. By this nasal potential difference test, the person, the doctor for example, who is assessing the diagnosis, takes electrodes and places them in the person's mouth. With these electrodes, they measure the amount of potential difference in the mucus. If there is too much potential difference in the person's mucus, it represents that the concentration of sodium chloride ion is too high for that one. This test may be so uncomfortable to children as there is too much of tampering with their body and all that. So before the test is carried out, young children are advised to be given some medication so that it becomes comfortable for them. And then we go to this genetic testing. With this genetic testing, if there are two CFTR genes in the person's body, then that's a positive test for cystic fibrosis. And if there is neither of the genes in the person's body, then that's a negative test for cystic fibrosis. Congratulations, because that will be confirmation that the individual doesn't have cystic fibrosis. But if there is one of the CFTR gene and one normal gene, then that person might be a carrier, and most probably their child might have cystic fibrosis. Statistics and life expectancy of cystic fibrosis. In the US, approximately 30,000 people have the disease. Around 1,000 cases are reported each year. 1 in every 3,000 children has cystic fibrosis. The average life expectancy of a CF patient is 32 years. In the UK, about 8,000 people have the disease. 1 in 2,400 children has CF. 80% of the people with cystic fibrosis are diagnosed at the age of 3. 10% of the patients are diagnosed at the age of 18, and 3% are diagnosed in adulthood. The average life expectancy of a CF patient is 38 years. In Canada, about 3,000 people have the disease, and 1 in 3,808 has the disease. Ladies and gentlemen, these figures are staggering, and we will be hoping that one day there might be a cure for this disease. Global mortalities of cystic fibrosis. Generally, this is a pie chart showing deaths per year of the disease. From the pie chart, you can see that the disease is more prone in the United States of America, where we got 46.4% of the people dying each year. This is too much. This is relatively too much. Let's look, for example, they are followed by Brazil with 7.2%, and the list is Cuba. They got 0.8%. Rarely people in this region they do not have the disease. Okay, let's get more deep into this prevalence of disease in the United States of America. The reason why it's highest in the US is because there may be so many carriers of the disease in the United States of America. And another reason is that in the United States of America, the population is too high. And every year we get so many immigrants coming to the US for survival. Oh, the other reason might be this. People come to the US to look for medication, and when they have found it, they never go back to their countries, and they stay in the States forever. So, ladies and gentlemen, the prevalence of the disease in the United States of America is just too much. Because cystic fibrosis has got no cure. Many of you are wondering, how do people live with this condition? But I got the solution in my hands. There are possible medications and treatments to help people with the disease manage it. Some possible cures that help to clear the airways For example, let's start in the lungs. People are given bronchodilators. These bronchodilators, they help to dilate the airways. In simple terms, that's making the airways get bigger so that it becomes easy for mucus to pass through and for the person to breathe. Bronchodilators help to reduce wheezing and coughing as the person tries to shift the mucus. On the other hand, the person is given antibiotics to help control persistent coughing and lung infection. Steroid hormones are also another option. They help to reduce inflammation of the airways. The person is also given a sample of the enzyme they call DNase. DNase helps it to make breathing more easier by breaking down the mucus. Another place for treatment is the digestive system. A person is given a sample of pills to help replace the lost pancreatic enzymes. These pills are taken in cooperation with food in order to help the person regain his weight from malnutrition. This sample of pancreatic enzymes also help to boost the person's appetite for food. Other areas of interest are bones. A person with cystic fibrosis has more chance of getting osteoporosis. Bisphosphonates can be used to treat the condition. Patients are also encouraged to exercise, take part in active games, as that helps them gain muscle and strength to their bones. The most important treatment of cystic fibrosis is physiotherapy. This is a daily treatment which is taken by the individual every day. By this mechanism, a person is told to lie down on the floor, and then their mother or their CF assistant, they help the individual by patting their back so that the individual becomes more relaxed. By this relaxation, it helps the mucus to flow easier to the nose and helps to clear the airways. With this physiotherapy, it helps to make it easier for the person to breathe during the day, and it helps the person to take part in more active games. Physiotherapy is the most recommended way of treating cystic fibrosis, actually maintaining it, as it is not cost effective. It's so cheap and anyone can afford it. Another possible option for a CF patient is a lung transplant. Lung transplants are mainly optional to the person. This is when the disease becomes so severe. The doctors advise the person to get a lung transplant. But the main problem with lung transplant is this. One, lung transplant is so expensive. Not anyone can afford to get a lung transplant. Two, the donor has to be the same blood group as the person. Another reason is this. If the donor is not in the same blood group, the immune system of the recipient may respond in a negative way and attack the lung in an immune response to defend the body, and so the lung becomes rejected. Lung transplant, they are so considerable option, but they don't mean that the disease has been cured. They only mean that it's going to help the person up to a certain period of time, but it doesn't necessarily mean that it's been cured. Though you may have a lung transplant, doesn't mean you don't have the disease. A day in life of Jonathan Farrell, a cystic fibrosis patient. This person is like us and is also normal, but the difference is that the guy is cystic fibrosis. Now let's take a look in his day. He wakes up at 6:45 in the morning and takes nebulized medication. After 15 minutes, at 7 o'clock, he takes some more nebulized medication. And as I was saying that at the time, this guy takes 20 minutes of physiotherapy. Moreover, he takes another 20 minutes of nebulized antibiotics from 7:35 to 8 o'clock. And then at 8:45, he takes inhalers in order to clear the airways. And at 8:50, he goes for breakfast. At 10:30, Jonathan Farrell had arrived at work and started working. At 11:30, he takes a mid-break snack. And at 1:30, he takes lunch. not forgetting about those pancreatic pills I told you about. You take some more tablets, the Creon digestive enzymes. The Creon digestive enzymes, those are the pancreatic pills I told you about. And it's mid-break, you take some more tablets, and that's only 2 hours later. And it's 18:30, that's 6:30, the guy leaves for home. At dinner, he takes 16 more Creon tablets. That's too much people for a person to take. And at 9 o'clock, before he sleeps, he takes nebulized antibiotics, moreover physiotherapy. And then just moments before he sleeps, the guy takes 10 minutes to take some more nebulized antibiotics to reduce the infections in the lungs. Ladies and gentlemen, overall the guy takes about 44 medicines during the day. So this life is so costly, and generally cystic fibrosis patients, those people, they are not living a happy life. But whether you have it or not, just accept the condition and you hope for the best. We just hope that one day we'll find a cure for this disease, and up until that day, our souls are still searching and waiting for that moment. Thank you for watching this video.